Hey guys, Tony Maritato here, licensed physical therapist, and I wanted to take a minute to come on live today, answer some of your questions. And first, I was going to start with two questions that came in through email. So let me read the first question. It says, "How do you feel about icing? I hear conflicting things, and that it should only be used if there is pain. I do use heat." So let's talk about that. And I've got a bunch of videos already on the channel, but we're talking about cryotherapy basically. When I was a young therapist, a lifetime ago, basically, I would have said ice reduces inflammation, which it does not. I would have said ice reduces pain, which it does for some people, but for some people, it makes the pain worse. I would have said ice constricts the blood vessels due to the coldness, vasoconstriction, but it only really does that superficially. So when somebody asks me about icing, I think ice is cheap, it's easy, it's an effective way to feel a different sensation, feel the sensation of cold, which may or may not distract you from the sensation of pain. Ice is generally safe. There are some people who are sensitive to ice. Ice does, for some people, make the pain more intense. In those cases, it's absolutely not a requirement. But if you feel like ice gives you relief, I know a lot of patients tell me that their knee feels so hot, it's swollen, it's uncomfortable. They put ice on it and it feels better. Awesome. Go ahead and use it. Certainly follow your surgeon's directive on how to use it. But if you are wondering if you have to use it because you don't feel like you really need it, typically look at the research. The research would suggest there's nothing beneficial or harmful regarding ice. If heat feels better to you, a lot of my patients feel like they get better range of motion with a little bit of heat. Go ahead and use heat. And in regards to time frame, I will see patients anywhere from 24 hours after surgery to literally 2 years after surgery. You can use either modality, heat or ice, anytime you wish. It's really just about finding the comfort zone for yourself, finding what makes you feel better. And if one or the other works better for you, then go ahead and use it. If neither one works for you and you just rather not mess with it, that's totally fine too. The other question that came in through email, I'm going to read it. Do you feel like there's a time frame where range of motion is no longer attainable? I hear conflicting things about that. Also, my home therapist had told me that I only had the first 4 weeks to get my range of motion back. So I would tell you again, I think context is everything. So during the first, 5 to 10 days, most of my patients are dealing with post-op pain, with swelling, with irritation. A lot of my patients will tell me they don't feel good bending the knee because either the water-resistant dressing that's covering the knee is uncomfortable, or they have staples and they feel like the staples are pulling. I don't stress out too much. If my patient is anywhere close to 0 on extension, I'm going to say 5 degrees to 0, and they're anywhere close to 90 degrees on flexion for the first 2 weeks, I'm totally happy. And a lot of that is going to depend on how the joint feels in the available range of motion. As your physical therapist, your therapist should be feeling the joint, should be moving the joint, should be able to determine if they think that there's more range of motion available, but you're just guarded because of the pain. That's all totally fine. In regards to time frame, so there's definitely windows of tissue healing that you're going to see in the clinical research. But what I tell everybody, I've got right now a group of patients that just had their knee replaced and they're doing amazing. I mean, it's just they have almost full range of motion, like pushing 110 to 115 at 2 weeks post-op. It's just incredible how well they're doing. But, 2 months ago, I had a group of patients that were really struggling. They were doing everything right. They were doing everything they were supposed to do, and they just weren't getting the range of motion that they wanted, that they expected. So while, yes, there's an initial window at the 4 to 6 week mark, I would say, where the tissue is certainly healing over from the incision, from the surgery, there's no end to when you can increase range of motion. If there was like a window where you said, if I don't get it by 4 weeks or 8 weeks or 12 weeks, I'm never going to get it, then nobody would ever increase range of motion doing flexibility training, mobility training, yoga, Pilates. Like there's lots of people who didn't have knee surgery who get tight joints who can loosen those joints back up. So what I usually explain to my patient is you've got the acute post-op phase, which could be anywhere from a couple days to a couple weeks. We want to manage the range of motion during that time. That's the acute healing process. Then you have what's called subacute, which could be from 2 weeks to 6 weeks to 12 weeks, where the tissue is still inflamed, it's still painful, but it's gotten over the acute healing window. And then you've got kind of this long-term healing. And so even once you pass 12 weeks, 26 weeks, 52 weeks, you're always going to be able to increase range of motion. It might not be the same kind of increase you get when you just had your knee replaced and you're in the acute stage, but you can always, always, always increase range of motion. And that's true for any joint in the body. That's true. You can always make your muscles stronger. You can always make your bones thicker. Like the body is incredibly adaptive. So don't stress out too much about the windows. If you're doing what you can do and only you know what you can do, then give yourself a break. Doesn't matter what the therapist wants. Doesn't matter what the surgeon wants. Your body is going to do what your body is going to do. And only you know what you've done and what you haven't done. But in my experience, most of the patients that aren't getting the range of motion they wanted to get or were expected, they're probably doing too much. And I've got videos talking about doing too much. I find that more people slow down progress by overdoing it, overworking, rather than underworking. I don't think, truthfully, I've ever met a patient who had a total knee replacement who genuinely did not do what they were supposed to do. Most of them did more than they were supposed to do. So real quick, Kelly says, I'm always icing on and off for weeks. Felt good for me. That's awesome. Like that's the key. If it feels good, do it. If it helps you be more functional, if it manages the post-workout soreness, any of those reasons are great reasons to ice. And I would not say there's any harmful effect of icing. The worst case scenario is it just doesn't help. You know, you spend 20 minutes with an ice pack on your knee and you feel no better. That's okay. Lisa in the comments says she's at 110 degrees of range of motion. Don't say only. 110 degrees is good range of motion. It's not terrible. And it's just staying the same. I'm giving another physical therapist another 3 months of physical therapy. I think that's a good move. You know, so I talked to somebody recently. They had been with a physical therapist. They had kind of stalled on the progress. We talked about a couple other things that might be contributing to why the range of motion isn't continuing to improve. But even for myself, like I take pride, I work hard, I want to help my patients the best I can, but I don't have all the answers. And I'm completely fine telling a patient, hey, try something different. So like I don't do dry needling. Other therapists do dry needling. Maybe there's a benefit to dry needling. And so I would encourage my patients to just try something different, a different philosophy, different energy. It could help. But absolutely, you just keep going. So Lisa also said, hoping to try a new physical therapist. He'll get me in better range of motion, but doesn't seem to be helping. I've been with him for 2 weeks. And you know what? Then you could try another therapist, or you could try you could try Pilates or yoga. You don't even have to try a physical therapist. But I will tell you from my experience doing this 20 plus years, I've seen a lot of patients where they work and they work and they work, and it's like they're just stuck at that 110, 115, 105. They just can't seem to get through it. And I've worked with them for months. And then all of a sudden, it's like something changes in their body and they jump to 120, 125. I have no idea. I don't understand it. They're working just as hard the entire time. Sometimes I tell them to work a little less. We do manual therapy. We do all the right stuff. But literally, it's like when the body is ready, the range of motion will come. As long as you're doing what you can do and the best that you can do, you know, there are just some things you don't have control over. You just focus on function. And this is what I tell my patients too. I'm like, who cares about the number? What's important is, can you do the things you want to do? Now, I'm assuming you can't, but you work toward the things you want to do and you don't stress out about the numbers, because the numbers could be off 10 degrees, 5 degrees higher, 5 degrees lower on any given day. Heather said, I have hypermobile joints. Is this likely to affect my total knee replacement rehab? Not really. So that's a great question. We work with women that have hypermobility, meaning very flexible joints. Um, and a lot of times what happens is when the surgeon does the assessment, the surgeon makes the determination on what implant they're going to use, what surgical approach they're going to use. Their objective is to build stability into the joint. So they might go with a little bit of a bigger implant. This is a question for the surgeon. They might tighten it up a little bit. And what I tell most of my patients is, and Lisa, this goes to you too. I would rather have a knee that's a little too tight because it can always be loosened. Even if it takes years, it will loosen. I would rather have a knee that's too tight but stable than a knee that's too loose. And Heather, to you, my guess is your surgeon's probably going to put in the right prosthetic, do the right surgical approach, do everything they need to give you a little more stability, knowing that you have a tendency to be hypermobile already. A lot of women, their knee not only goes into zero extension, it goes into hyper extension. But once they put the implant in there and they close everything up, you're going to have more stability than you probably had before. So, all right, guys, I've got to run, see what my kids are doing. I just wanted to come in, answer those 2 questions. I'll try to do a couple more live Q&As here. This was a last minute deal, but thanks all for joining. If you haven't subscribed to the channel, please check it out and feel free to check out the free Facebook group, Total Knee Replacement Support Group for Kind People. I'll catch you guys on the next stream.